November is National Diabetes Month, and the theme for this year is Take Charge of Tomorrow, Preventing Diabetes Health Problems. Now celebrating its 10th anniversary, the Maria Holder Diabetes Center, located in Warren St. Michael, has been in the forefront of looking after the needs of diabetics and pre-diabetics in Barbados. Whether it's diabetic eye screening, vascular screening, podiatry services, advice on nutrition, our range of diabetes specialists, doctors, and nurses are available to fulfill your diabetic needs. Call and make an appointment today at 243-3937 or 417-0305. The Maria Holder Diabetes Center. BART members get 10% off.
A special Q morning to everyone listening to 100.7 QFM. This is November, which is not only our Independence Month, but it is also Diabetes Month, ladies and gentlemen. And today, Thursday, is another Q day. And I know everybody is excited about going down to Rascals today.
I'm excited for Q.
Because you know that Q is good for you. But this is Peter Boyce here. And you know what else is good for you? The next 15 healthy minutes that you hear on QFM, which is being sponsored by the Maria Holder Diabetes Center, along with the Barbados Diabetic Eye Screening Program. You might be listening to QFM right now and asking yourself,
exactly why is the Maria Holder Diabetes Center good for me?
But I am glad you asked that question. If you are diabetic or pre-diabetic, the Maria Holder Diabetes Center, located in Warren St. Michael, right behind Eunice Gibson Polyclinic, has got you covered when it comes to supplying you with international standard health care at a fraction of the price that you will have to pay at other places. And how are they able to achieve that, you might ask? Because of government contributions and donations from charitable corporate partners. So we are going to start this show off by highlighting one of those donations. A donation of $22,000, which was recently made to the foundation from the Rotary Clubs of Barbados. As Trevor Eastman would say, you have to clap for that. And the purpose of this donation was to purchase an autoclave. Now, you might be out there listening to QFM and you might be wondering, what's an autoclave? I never hear about an autoclave yet. What does it do? For the answer to that, we will bring the General Manager of the Diabetes Foundation, Miss Marsha White, to tell us exactly what is an autoclave.
An autoclave is a piece of equipment that sterilizes our equipment that we use in the treatment and management of our patients who are living with diabetes. It is absolutely essential because without proper sterilization, as you can imagine, our equipment will be contaminated and we'll be contaminating one patient to the next, and that's obviously not something that a medical facility could ever accept. So we do have an existing autoclave, just to be clear, but it is older, and we recognize that we needed to upgrade our autoclave and have a new one. And we rely on the generosity of donors in the Barbados community, and there is a lot of generosity, but we were so grateful that the Rotary stepped forward and offered to cover the entire cost of a new autoclave. And having something brand new like this, we know that it's going to be a lot more efficient, even in terms of energy consumption, which we're really conscious of, because everything we do now, we're conscious of the environmental impact, and obviously we're also fiscally responsible because we are a charity. The Barbados Diabetes Foundation is a charity, and we're always in need, and we have to rely, as I said, on the generosity of donors.
Thank you, Marsha, for that explanation of exactly what an autoclave is. So as we continue on QFM, we are now about to bring in the manager and treasurer of the foundation, Mr. Dwight Edgell. He was on Morning Barbados recently, and he was talking about exactly why the Diabetes Foundation was established, and this is what he said.
The foundation was originally conceptualized to be a one-stop shop. Dr. Oscar Jordan, God rest in his grave, he was the consultant at the QEH, and he recognized this deficiency because, as you know, quite a few Barbadians cannot afford the coverage of care that's required across all the platforms that are needed to treat diabetes. The foundation came into existence because of that, and what we have done, we have built on that platform. We've added so many other different services now. When we started, we just had a podiatrist or a podiatry department, dietitian, doctors, and a diabetes specialist nurse. We have since then added a vascular screening department, a foot screening department, and a retinal screening department. And what we are doing, we are trying to ramp up these services offered that we can now more involve ourselves in the areas that diabetes also affects. So with our eye screening department, we look for early detection for diabetic retinopathy. We have vascular screening, which looks for reduced circulation or circulatory problems. And we do have foot screening, which allows us to get a more in-depth recognition of whether your pulse or the flow of blood in your feet is being affected. And we've only been able to do that because our donors, people who are unsung heroes, give without any reward or notice, and we are fortunate. And what I want to take this occasion to say is that Barbadians are blessed. We have a unit like the Barbados Diabetes Foundation where there's no comparative space like that in the Caribbean, and where people can come free of cost through a referral from the polyclinic. And I'm urging everyone this morning who knows someone, especially people in my age group, the 60s, etc. We maintain to dilly-dally with our health. That early detection, as Hillary and Dr. Clark were saying, is important. And you can go to the polyclinic, have a referral, come to a well air-conditioned space. You have doctors, podiatrists, cardiologists. All these things are provided free for Barbadians. And it hurts my heart when I live in the country. I'm still a barefoot guy. And I hear my friends having, losing body parts, for lack of a better description, because they can take the time to go to the polyclinic to be referred. The government itself has been great because the government is who pays for these services. And I want to, last of all, exhort everyone to avail these things that are for us Barbadians who really can't afford this care anywhere else.
Thank you, Dwight, for telling QFM listeners all about the benefits of the Maria Holder Diabetes Center, an institution that we can be proud of as we celebrate 58 years of independence, Diabetes Month, and 10 years of existence of the Maria Holder Diabetes Center. It's now time for our musical break with Mark Lord with My Country. Compliments the Maria Holder Diabetes Center.
My country to me is the sense of feeling free and having the right to speak your mind out. That is my country to me. It is the air I breathe. I'm so proud to be born here, and the love and beauty that surround us, we share it day by day. That is my country to me.
Attention BARP members, the Maria Holder Diabetes Center will be having special diabetic screening clinics at the BARP office in Hastings every Thursday in November. So there are only 2 more Thursdays to go, today and next week. So make sure you call and book. You can get diabetic eye screening and podiatry foot screening only $90 each, or get both for only $175. That's a big saving. Book your appointment now, 417-0305 for diabetic eye screenings at the BARP office every Thursday in November only. Also take note, podiatrist Louise Robinson will be doing foot screening at the Maria Holder Diabetes Center on Saturday the 14th of December. Write it down. Saturday the 14th of December from 9 a.m. to 1 p.m. Call and book your appointment to see a world-class foot doctor. The 14th of December, 417-0305 to make that appointment. Bring lawyer foot and come.
And the love and beauty that surround us.
There's a fuzzer here. I have a question for Dr. Louise. There are some people out there listening to QFM. I will not call any names. There's like to buy shoes that are in fashion, even though they might be too small for them.
I like to wear shoes that make me look like Rihanna.
The question I have for Louise, what advice do you have for people who like to buy small shoes because they're in fashion?
It's a no-no. What I would say is look for the right shoes to improve your performance. not to look good, because if we look for shoes to make you look good, you can guarantee they're going to cause you problems in the long run. So don't look at style, look at comfort. And to look at shoes, when you're choosing a pair of shoes, when you put your feet in them, you should have room to wiggle your toes at the very top. Because if you think about it, shoes are not designed for feet. They always have this narrow pointedness, stylish. That is not what our feet are looking like. So your feet should be able to move around. It's important that we wear socks to not cause any sort of rubbing and chafing, because that can then cause breakdown and then cause problems again with diabetic feet. We should always try and keep our feet moisturised. But what's important, when I ask somebody when they go to the shop to look for a pair of shoes, look at what you want it for. What is it you're needing? Are you going to church? Is it for sports? Are you standing on your feet all day? Look at the material. That's really important. The shoe should be made from leather, suede, which allows the foot to breathe. Look at the shoe. Is it supporting enough? Does it help reduce pain in the ankles? Does it, look at the shape of the shoe? So that's important. So, like I said, we need to replace our shoes on a regular basis. And I know things are expensive, but our feet are our foundation. And if the foundations are not right on anything in life, then everything else falls. So it's important that we need to wear the right footwear.
We now welcome to the show a patient at the Maria Holler Diabetes Center, Ms. Cheryl Rivera. Welcome to the show, Cheryl.
Thank you.
Cheryl, how long have you been living with diabetes?
Well, I was diagnosed in the year 2004.
Share with us your experience of the challenge of living with diabetes.
It has been very challenging, and sometimes the lack of knowledge can be very fearful. And because I had developed diabetic neuropathy in my feet in the year 2017, that was a challenge. And I was recommended to attend the Diabetic Center at Warren's. And that was the best decision that I could have made, because there they gave good advice on treatment. And I like the fact that they have a complete team, a range of medical assistance for diabetics, such as your eyes, your heart, your mental health, which is important, and your general health. And they're very professional. And I like that. My experience is that they went over and above on one occasion where they were able to facilitate me with a prescription on a weekend. And that was for one of our members of the family who is diabetic as well and had a challenge. So I was very thankful for that.
Okay, Cheryl, did you find that spiritual guidance played a part in helping you to cope with your diagnosis of diabetes?
Yes, very much so, because it is a journey that you have to face alone. But you're not alone in terms of the support that you get from your church members and your pastor and those others, because prayer is very important. And although you pray for yourself, others praying for you, that is a more foundation, and it gives you that support that you need. I'm saying that diabetes is not a death sentence. It's challenging, but you can manage it. You can live with it. You need to be disciplined. And you need to follow your exercise program, your diet program as well. And in everything you are looking at, you be moderate. Don't eat a whopper ton of food at one time. Use your portion control, get your exercise on, and you will be okay. And also make sure, if you're listening to the program this morning and you haven't already gone or done so, please visit the Diabetic Center at Warren's. There's a great team there. They give you advice, they guide you through, and you'll be much better for it at the end.
If you are diabetic or pre-diabetic and listening to QFM right now, quality health services at lower prices is what you will find at the Maria Holder Diabetes Center. For more information, call 417-0305. So as you're out there enjoying Q in the community today, remember to try and eat healthy, and don't miss next week's show when we will be dealing with more diabetic issues. Same Q time, same Q station. The Maria Holder Diabetes Center Radio Show.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse
diabetes. Certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.